Clinical Decision Support for Special Populations. Clinical Decision Support Systems, CDSS, can significantly enhance the management of special patient populations by tailoring healthcare decisions to meet the specific needs of individuals with chronic conditions, pediatric or geriatric considerations, and those in specialized care units. The flexibility and adaptability of CDSS allow healthcare providers to customize treatment plans based on the unique characteristics of each patient group. Here's how CDSS supports various patient populations. 1. CDSS in chronic disease management, diabetes, cardiovascular disease, etc. Diabetes management. CDSS can provide personalized recommendations for managing diabetes by analyzing factors such as blood glucose levels, HbA1c, medication adherence, lifestyle factors, and comorbid conditions, e.g., hypertension. It can alert healthcare providers to potential complications such as diabetic ketoacidosis or hypoglycemia and recommend changes in medication or lifestyle adjustments. Example: a CDSS can analyze a diabetic patient's blood sugar patterns and suggest insulin dosage adjustments or alert the clinician if blood sugar levels are consistently out of range. It can also remind patients of important lifestyle changes, such as dietary modifications or exercise regimens. Cardiovascular disease, CVD management. CDSS can be used to assess cardiovascular risk factors, e.g., blood pressure, cholesterol levels, smoking status, family history, and suggest individualized treatment plans for preventing and managing cardiovascular diseases. It can offer real-time monitoring for patients with heart conditions, recommending interventions such as statin therapy or antihypertensive drugs. Example: for a patient with hypertension and a history of myocardial infarction, the CDSS might suggest adjusting their antihypertensive medication regimen and scheduling regular echocardiograms or stress tests to monitor heart function. Chronic obstructive pulmonary disease, COPD. In patients with COPD, CDSS can provide guidelines for managing flare-ups, adjusting oxygen therapy, or recommending pulmonary rehabilitation. It can analyze the patient's symptoms, spirometry results, and exacerbation history to alert clinicians of potential deterioration. Example: a CDSS may notify a healthcare provider if a patient with COPD exhibits worsening respiratory symptoms, suggesting the addition of corticosteroids or adjusting the patient's oxygen levels based on real-time monitoring data. Asthma and other respiratory conditions. CDSS can help manage asthma by tracking symptom severity, triggers, and medication usage. It can also offer guidelines for adjusting medication based on real-time assessments of lung function, e.g., peak flow measurements, or patient-reported symptoms. Example: in a pediatric asthma patient, a CDSS can alert the healthcare provider to review the patient's inhaler technique or increase corticosteroid use based on repeated instances of wheezing or declining peak flow rates. 2. Utilizing CDSS for pediatrics, geriatrics, and special care units, pediatrics. Pediatric patients require unique considerations in diagnosis and treatment, and CDSS can be tailored to account for a child's age, weight, developmental stage, and growth patterns. In pediatrics, CDSS can assist in dosage calculations, vaccine schedules, and tracking developmental milestones. Example: in pediatric diabetes management, a CDSS can recommend insulin dosing based on the child's age, weight, and insulin sensitivity. It can also provide alerts for age-appropriate immunizations and screen for childhood developmental delays based on clinical guidelines. Geriatrics. Older adults often present with multiple chronic conditions, polypharmacy, and age-related physiological changes, making healthcare decisions more complex. CDSS can help address these challenges by offering recommendations based on comprehensive assessments of comorbidities, medication interactions, and geriatric syndromes, e.g., falls, dementia, frailty. Example: for an elderly patient with dementia and diabetes, A CDSS can suggest modifications to diabetes treatment, taking into account the patient's cognitive status and potential for medication non-adherence. It can also alert healthcare providers to potential drug interactions or adverse effects due to polypharmacy. Falls prevention. CDSS can support the identification of high-risk older adults and recommend preventative measures such as exercise programs for balance, home safety modifications, and medication adjustments to reduce fall risk. Example: the CDSS might generate a fall risk score based on factors like mobility, history of falls, and use of sedative medications, alerting clinicians to intervene with appropriate measures like physical therapy or adjustments to medications that increase dizziness.
Special care units, ICU, NICU, etc. In critical care settings such as intensive care units, ICUs, or neonatal intensive care units, NICUs, CDSS provides real-time support for managing life-threatening conditions. In these environments, CDSS can help monitor vital signs, suggest interventions based on continuous monitoring data, and identify early signs of clinical deterioration. Example: in the NICU, a CDSS can assist in the management of premature infants by tracking parameters such as oxygen saturation, feeding tolerance, and bilirubin levels, alerting clinicians if there are signs of complications like jaundice or respiratory distress syndrome. ICU patients. In the ICU, CDSS can analyze continuous data from monitors, EEG, ECG, blood pressure, respiratory rate, and flag signs of sepsis, organ failure, or other critical conditions. It can help clinicians prioritize interventions, such as initiating antibiotics or adjusting ventilator settings based on real-time data. Example: a patient in the ICU with septic shock may have their vital signs monitored through a CDSS, which may alert clinicians if there is a decline in blood pressure, prompting the administration of vasopressors and further investigation into the source of infection. 3. Customizing CDSS for diverse patient needs and conditions. Personalized treatment plans. CDSS can be customized to accommodate specific patient needs by integrating clinical guidelines and protocols for various conditions while considering the patient's individual characteristics, such as genetics, lifestyle, and preferences. Example: for a patient with diabetes and a genetic predisposition to heart disease, the CDSS can customize treatment recommendations by integrating relevant clinical guidelines for both conditions and suggesting medications or lifestyle changes that address both concerns. Multimorbidity considerations. Many patients, especially the elderly, suffer from multiple chronic conditions that require coordinated care. CDSS can integrate management plans for multiple conditions simultaneously, reducing the risk of contradictory treatment approaches or medication interactions. Example: a CDSS can recommend an integrated approach for managing a patient with hypertension, diabetes, and osteoarthritis, balancing medication options that address each condition without causing adverse interactions. Cultural and socioeconomic factors. CDSS can be adapted to consider cultural and socioeconomic factors that influence health behaviors and treatment adherence. For instance, CDSS can recommend interventions that take into account a patient's dietary habits, access to healthcare, and language barriers. Example: if a CDSS identifies that a patient from a lower-income background struggles with medication adherence due to cost, the system may prompt the clinician to consider alternative therapies or assistance programs to improve adherence. Patient engagement. CDSS can also be used to empower patients in managing their own care by providing them with personalized health information, reminders, and alerts through patient-facing applications. This can improve patient engagement and self-management, particularly in chronic disease settings. Example: a CDSS might include a mobile app that sends reminders for medication refills tracks daily symptoms, and encourages healthy lifestyle choices, such as diet and exercise, based on the patient's chronic condition, e.g., diabetes or hypertension.